A lot of people want holistic healthcare, but they have no idea where to start. What's the difference between integrative medicine, functional medicine, naturopath, chiropractors, and all of the health coaches out there? And so today I want to break it down so you know exactly who to go to for what. So stick around to learn how to find the best practitioner for your needs. Holistic doesn't mean anti science, it means looking at the body as a whole. Holistic doctors is often used as an umbrella term, but it's really not a regulated medical title. It generally refers to practitioners who take a whole body approach to health, considering physical, emotional, and sometimes even spiritual aspects of well being. However, not all holistic doctors or holistic providers have the same training, credentials, or even scope of practice. So, who falls under the holistic doctor umbrella? Here are the main types of practitioners out there that people can often lump into the holistic category. First, there's integrative medicine practitioners, which are going to be your MDs, your DOs, your NPs, and PAs. Then there's the functional medicine practitioners, and there's two different types. There's medical versus non-medical here. Then there are the naturopathic doctors, like your NDs, your NMDs. Then there's chiropractors, which are DCs. Then there's traditional Chinese medicine, which is TCM, and Ayurvedic doctors. And then there are holistic nutritionists and dietitians, which are going to be RDs, CNS, and health coaches. So, why this term holistic doctor can really be misleading. Not all practitioners under this umbrella have the same medical authority. Some states do not recognize certain holistic credentials, meaning a functional health coach and an integrative doctor or provider might be called holistic, but their scope is very, very different. The term is used very loosely in marketing because it is a buzzword, it's easily identifiable, and people gravitate towards that. So it's very important to check credentials before choosing a provider. And what sparked me to do this training is I got a text message, hey, do you know of any good holistic doctors? And they put the location, and I was like, okay, well, what areas specifically are you needing help with, essentially? So, first up, let's cover integrative medicine practitioners, and that's going to be anywhere from doctors like medical doctors, doctor of osteopathic, so those are your medical doctors, or there's going to be NPs, which nurse practitioners, which is what I am, even PAs, physician assistants, physician associates. They are also considered, for the most part, integrative medicine when they fit these criteria. So, what they do, they use conventional medicine plus functional evidence based alternative approaches to treat the whole person and not just symptoms. Their scope of practice is they can diagnose, they can prescribe medications, they can order labs, and create a personalized treatment plan that blend conventional, functional, and holistic methods, all of the above. So, who might want to see an integrative medicine practitioner? If you want a medically trained provider who also considers a step approach of lifestyle, nutrition, natural therapies in your care, if you have autoimmune conditions, hormone fluctuations, and imbalances, gut dysfunction, or chronic fatigue, and you want to also use that lifestyle based solutions, if you're willing to invest in advanced testing and natural interventions when needed, and medications also is in that spectrum as well. If you want a provider who can help you wean off medications when appropriate, or optimize treatment just beyond a prescription, this is a great option too. So this is how functional medicine fits. It is within the umbrella of what an integrative medicine practitioner will help with. They are fully licensed to diagnose, prescribe, order tests, and treat those medical conditions that they specialize in. They use the traditional and functional medicine labs. and blend them to what their processes has found is optimizing things. They're going to also use lifestyle interventions, alternative therapies alongside those conventional medicine modalities. They can integrate that functional medicine with medications and advanced testing, the clinical protocols, all of that. The average cost for working with an integrative medicine practitioner is going to be anywhere from $600 to $5,000 for an initial program based. We're going to talk about insurance here in a little bit, but the follow-up costs will range anywhere from $200 to $500. Specialty lab testing, which could include a whole host of other labs besides these ones, but gut health, hormones, genetics, these can cost anywhere from $200 to $1,500, depending on the specific labs needed for each individual case. And however, some lab work, general lab work, can be ran through insurance. However, the provider really cannot guarantee how much it is going to cost on that end if insurance is used. Okay, let's talk about functional medicine practitioners. What do? They focus on root cause of disease using advanced lab testing, gut health, detoxification, and lifestyle changes, which again, functional medicine is under the umbrella of integrative health practitioners as well. Their scope of practice, this can include MDs, NPs, PAs, DOs. There can also be chiropractors, nutritionists, health coaches, among others who have gone through functional medicine training. Some can prescribe, like the MDs, DOs, NPs, PAs, while others really focus their talents on the diet, supplementation, and other lifestyle things. As I said, there's medical versus non-medical functional medicine practitioners. So how functional medicine fits. Many certified functional medicine practitioners come from a health coaching, nutrition, or alternative health backgrounds. They can provide that lifestyle guidance, supplementation recommendations, and some can do lab analysis if they are trained and certified in that. They can help patients with gut health, detox, hormone balance, inflammation, and metabolic optimization. Where this does not fit, they cannot diagnose medical conditions, they cannot prescribe medications, they cannot recommend dose adjustments on medications, they cannot order or interpret medical labs in most cases unless they have additional healthcare licenses. If a patient has serious medical conditions like diabetes, autoimmune disease, cancers, stuff like that, they need a licensed provider for medical management. Best case scenario is for these functional medicine practitioners to work alongside an MD, DO, NP, or PA that is trained in functional medicine for a comprehensive team-based approach. The average cost, again, pretty similar to an integrative health practitioner, $600 to $5,000 for an initial program. Cash-based follow-ups range from $200 to $500. And then there is the cost of specialty lab testing, which is almost never covered by insurance. All right, let's talk about chiropractors. What they do, they focus on spinal adjustments, musculoskeletal alignment, and sometimes some nutrition-based approaches. Their scope of practice, they cannot prescribe medications or diagnose outside of their musculoskeletal expertise. Who might want to see them? If you've had back, neck pain, headaches, joint issues, or sports injuries and want a non-invasive solution, or if you're looking for nervous system support, posture correction, or spinal alignment therapies, if you're pregnant or postpartum and need pelvic alignment or pain relief, this can also be a great approach. Here's the thing. A lot of functional medicine practitioners are chiropractors. So many chiropractors pursue functional medicine training because they've noticed this in their practice. There's a lot of gut health issues, hormone imbalances, chronic pain, and inflammation. They can use nutrition, lifestyle medicine, and and supplements to support whole body healing. Some states will allow chiropractors to order and interpret certain labs, but not all of them. Where functional medicine doesn't fit, they cannot prescribe medications. They cannot officially diagnose or treat medical conditions beyond those musculoskeletal issues. Their scope varies by state. So some can order labs, some cannot. Best case scenario is a chiropractor who's trained in functional medicine can help with inflammation and lifestyle-based health, but they should refer to a medical practitioner for that medical oversight. The average cost is $40 to $200 per session, cash-based. Some have programs as well where you pay up front for X amount of treatments. And treatment plans often include multiple visits per month. Now, let's talk about naturopaths. So, naturopathic doctors like NDs, NMDs, they use natural therapies, herbal medicine, homeopathy, and lifestyle-based treatments. Really, their scope of practice varies by state as well. Some can prescribe medications and order labs, while others focus only on natural remedies. Who might want to see them? If you want a natural approach with herbal and alternative therapies, but you still want that medical guidance, if you have chronic conditions like hormone imbalances, gut issues, and you want to avoid pharmaceuticals, if you want a homeopathy, this is a big one, homeopathy-based or herbal medicine approach, this can be very, very helpful. Homeopathy is a system of alternative medicine based on the belief that like cures like, meaning that a substance that causes symptoms in a healthy person can, in very diluted amounts, treat those symptoms in a sick person. It was really developed in the late 1700s and is still used today, particularly by naturopaths and in the alternative medicine circles. And this is something that I am not trained on. This is not in my umbrella of expertise. So, for example, I just finished a 4-month intensive overhaul with a client, and she is well versed in homeopathy and she wanted to blend it. And I straight up told her, this is not something that I am skilled in helping you with. I am more than willing to work with you to find a plan that blends both your homeopathy love as well as some things that I think we are needing to implement to get you feeling better based on your conditions. So that's a big part of things too. How functional medicine fits. It's very similar philosophy. Naturopathy and functional medicine really both focus on that root cause healing, the advanced lab testing, and natural interventions. Many NDs practice functional medicine without actually calling it that. You can prescribe natural treatments, the lifestyle changes, supplements to correct these imbalances with an ND as well. Where functional medicine doesn't fit. Like I said, scope varies by state. Some NDs can prescribe medications and order labs, while others cannot. Some are not recognized as medical doctors in some states, meaning that patients might still need to see an MD, DO, and PPA for that comprehensive care. And insurance rarely covers naturopathic medicine, like pretty much all of this, making it fully out of pocket. In the best case scenario, if an ND has prescribing authority and lab access, they can fully integrate functional medicine into their practices. If not, they may collaborate and work alongside an MD, NP, or PA for medical oversight, which is something that I do as a functional coach in those areas that I am not licensed in. I am more than willing to work with their family care providers to provide a comprehensive plan for those clients. The average cost for a naturopathic doctor is about $150 to $400 for an initial visit. Some of them may also have program packages too. Follow-ups range from $75 to $250, and as I said, it's not covered by insurance in most states. So, let's now move to dietitians and nutritionists. They help patients use food as medicine. They help create structured meal plans and address nutrient deficiencies, which is huge. Their scope of practice. Registered dietitians work in hospitals. They provide medical nutrition therapies like diabetes, heart disease, gut disorders. Some of them may take insurance. Then there's nutritionists. That can vary in training as well. Some have certifications, but not all are licensed as medical professionals. So who might want to see them? If you need structured, science-backed dietary guidance for weight loss, gut health, chronic disease, or sports performance, if you have food sensitivities, digestive issues, or you need help optimizing your macronutrients and your micronutrients, if you struggle with eating disorders or metabolic conditions and need a specialist. So how functional medicine fits in this? Many registered dietitians and nutritionists really incorporate that functional nutrition, which is part of the whole lifestyle approach to healing. They can do gut healing protocols, micronutrient testing. Functional dietitians can use labs like organic acid tests, food sensitivity panels, and stool tests in some cases. This is really ideal for metabolic health, gut disorders, weight loss resistance, and chronic disease prevention. So where does it not fit? RDNs working in hospitals or insurance-based settings cannot practice functional medicine freely. They cannot diagnose or treat medical conditions unless they have that additional licensing. And not all nutritionists are credentialed. Some are health coaches without medical oversight. The best case scenario is a functional dietitian working with a medical provider that can provide next level nutrition-based healing. The average cost is going to be $100 to $250 per session, and some RDs may take insurance. They can do custom meal planning programs, which will range from $500 to $1,500 in cost there. My final thoughts and best strategy for the people that I work with. As I said, do integrative functional medicine, and I really feel like that is the best for full spectrum care. Chiropractors and NDs and functional medicine coaches are great for lifestyle-based support. RDs and functional nutritionists are ideal for food-based healing. And many times there's practices that have a combination of these practitioners. And really, that can be the best approach, is having combined multiple specialties for the most well-rounded personalized care. So how to choose the right practitioner. And I'm not going to be able to see this very well. Hold on just a second. My bubble is obviously in the way, so I had to pull it up on a different slide. But first up is to really identify your needs. Do you need the diagnosis and prescriptions, which is going to come from a medical practitioner? Do you need the advanced testing, which would be functional and integrative? Or do you need that hands-on therapy, that manipulation? Then checking credentials. Not all holistic practitioners are medically trained. Look at the licensure, the training, and board certifications. And I've listed along here what the common ones for each of these specialties are. And then number 3, ask about their approach. Do they prioritize root cause, symptom management, or herbal medicine? How do they go about their approach? And number 4, what specialty testing do they have training in? Can they interpret complex lab data to create a targeted plan? I feel like this is very important because a lot of people will come to me and they say, do you use the Dutch test? Because it is very common hormone testing out there. And am I trained in that? Yes. Do I use it? Not very often, because I found other ones to be more beneficial for the people that I work with and choose to route their money in that direction. But it's very similar to the Dutch test. So some people, I think it's very important to know what specialty labs they are trained in. Also, gut health. That question, that text message at the first of this was asking about gut health specialty. Like, that's when she wanted expansion on things. It was her significant other was needing some pretty intensive gut health stuff. And I advertise that I do hormones, but a lot of what I do is rooted in gut health too. So I'm actually very specialized in food sensitivity testing, stool testing, things that are going to help the gut. Okay, why do holistic practitioners not accept insurance? And this is something that breaks my heart because I am unable to accept insurance for various reasons. The problem is insurance dictates care. It limits your testing that is available. And then when you try and order stuff, they get slapped with a giant bill. And then they also limit treatment and the time to be able to spend with those patients. Here's the thing. This is probably the biggest for me. Insurance favors quick, symptom-based care, not those deep-rooted solutions. And this is why it is so hard for people to actually get the help that they're needing from their primary care practitioners, because it is so quick, and that's how they have to be. It's restricted in testing options. They won't cover comprehensive hormone, gut health testing, genetics, micronutrient testing, any of that fun, really necessary stuff. It focuses on medications. Insurance reimburses drugs over lifestyle and root cause care, and there's low reimbursement rates. Providers are forced to see high volumes. My husband is a primary care provider, and his company is always after him to see more and more patients throughout the day, and they have minimums that he has to meet, and he feels that he isn't able to give the best care due to that. And this is one of the biggest reasons why I have not gotten credentialed recently with insurance, because it was making it so that I would have to see up to 4 to 6 patients per hour, where I usually find it necessary to spend anywhere from 30 minutes to 60 to 90 minutes with each patient. And then there's the loss of autonomy. Functional and integrative providers really do prioritize customized patient-first care over that insurance red tape. So here's where we go into the Bliss method. This is my method that I have developed over 10 years of practicing, and I have found it to be very successful in helping people get to the root of their issues. I first like to identify, okay, we're doing specialty testing and figuring out what is happening there. We're identifying root causes. We are combing through health history, everything. And then I like to strategize. I'm going to show you a little bit more about my strategy process, because it is a very layered step-up approach. And then I'm passionate about empowering people. I do not want people to feel like they have to come to me for every question. I like people to be able to troubleshoot their own issues on their own and not feel like they have to get the help. And I want them to be empowered there. Here are the lab specialties that I have been highly trained on. I do functional lab work, which is essentially taking your basic labs and honing in on not just normal, but optimal levels for men and women. I do advanced hormone testing, including saliva and urinary testing. I do full comprehensive thyroid panels. I love looking at neurotransmitter balance, which is huge, and I think a very rare thing for most even functional practitioners to be trained in. I do extensive micronutrient testing, which is super cool. And then genetic optimization, which I feel like is very unique and not very many functional and integrative therapy practitioners are very skilled at. I do advanced gut health testing, including food sensitivities, as well as advanced stool testing. I do toxins and stealth infections. Stealth infections are going to include like mold, your Lyme disease, Epstein-Barr virus, and among other things. So my strategize section. This is where it is very step up approach. Yes, we've got lifestyle interventions that need to happen, strategic supplementation, prescriptive aid if needed. I don't perform surgeries. I do minor surgeries, like I can do stitches, mole removal, stuff like that. But this is going to be like your more advanced surgical procedures, and I will refer out for those things. And then, as I said before, I am very big on empowerment. I want people to have their health in their own hands and be able to learn what they need to know to navigate things successfully for life. So my name is Megan Bliss. I am a nurse practitioner, and I am big in hormone health and love to help people that way. My website is meganbliss.com. And these are the services that I provide. It's definitely a different approach to stubborn weight, low energy, and mood struggles. I look at hormones, thyroid, gut health, neurotransmitters, genetics, weight loss, so many things. I use advanced and functional lab testing. I do group appointments, self-study programs, and then one-on-one intense high-level, high-touch care. So feel free to book a free consult. Go to meganbliss.com and you can find the link to do that.